Here's something that surprises most of my patients. The harder you starve yourself, the more your body fights to hang on to belly fat. Not because you're doing something wrong, but because your body doesn't know the difference between a diet and a famine. Let me explain what's actually happening. When you cut calories hard, your body reads that as danger. It doesn't know you're trying to look better in your summer clothes. It thinks food might be running out. So it slows your metabolism, it turns up your hunger signals, and it makes you move around less without you even noticing. This is a survival response that kept our ancestors alive. The problem is, it also puts a ceiling on how much fat you can lose just by eating less. After a certain point, cutting calories further barely moves the needle on the fat that matters most. And I do mean the fat that matters most, because not all fat is the same. The fat you can pinch under your skin is one thing, but visceral fat is different. It sits deep in your abdomen, wrapped around your liver, your intestines, your pancreas. And here's the part most people don't realize: visceral fat isn't just sitting there, it's active. It's constantly releasing chemical signals that drive inflammation throughout your entire body. That inflammation is a big part of why visceral fat is linked to heart disease, type 2 diabetes, and even memory problems later in life. So if cutting calories has a ceiling, what actually works? In my practice, I focus on 3 specific signals inside the body. Once you understand these 3, the whole picture becomes a lot clearer. The first signal is inflammation itself. Visceral fat cells release inflammatory messengers, and those messengers actually make it harder for your body to break the fat down. It's almost a defense system. Inflamed fat protects itself from being burned. So one of the most useful things you can do is calm that inflammation down. Foods rich in omega-3 fats do this well. Fatty fish like salmon or sardines are excellent, and if fish isn't your thing, walnuts are a solid plant-based option. I usually tell my patients, think of omega-3s as turning down the volume on that inflammatory alarm system so your body finally gets the all clear to start burning stored fat. The second signal is how your body handles insulin. When your cells stop responding well to insulin, your pancreas has to produce more and more of it just to keep your blood sugar in a normal range. And elevated insulin is a direct fat storage signal, especially around your organs. This is why 2 people can eat the exact same number of calories, and one stores fat around the belly while the other doesn't. Insulin sensitivity is often the hidden difference. The good news is this is very responsive to diet. Leafy greens, colorful berries, and fermented foods like plain yogurt or sauerkraut have all been shown to support healthier insulin response. Even something as small as a daily half cup of berries can help nudge this system in the right direction over time. The third signal is the one that actually flips the switch to fat-burning mode. This is where extra virgin olive oil deserves real credit. The polyphenols in good quality olive oil activate pathways in your cells that essentially tell your body, start pulling energy from fat stores. There was a well-designed trial comparing olive oil to a different cooking oil, with both groups eating identical calories. The olive oil group lost meaningfully more body fat, using the same calorie deficit. That tells us something important. Not all calories send the same instructions to your body. The source of your fat matters, not just the amount. Now, once you've got the nutrition piece working in the background, movement becomes your accelerator. And I want to be honest with you about something. The research is fairly consistent that higher intensity activity, things that genuinely raise your heart rate, tends to outperform gentle movement specifically for visceral fat. But before that scares anyone off, let me reassure you, this does not mean grueling workouts. A simple way to check your intensity is the talk test. If you can carry a conversation but you're a little winded, you're right in the useful zone. If you're gasping and can barely get a sentence out, that's fine too, in shorter bursts. What matters far more than intensity is consistency. 2 or 3 sessions a week, even just brisk walking uphill or cycling at a steady pace, done consistently for months, will outperform an intense workout you dread and skip. And here's something I want every patient of mine to hold on to. In several of these studies, participants lost a significant amount of visceral fat while their body weight on the scale barely changed. That's not a failure. That's your body composition shifting in exactly the direction you want, even when the number on the bathroom scale refuses to cooperate. I've seen this in my own patients more times than I can count. Someone frustrated that the scale won't budge, and then their labs come back and their inflammation markers, their blood sugar, their blood pressure have all quietly improved. The scale is simply not a good judge of what's happening on the inside. So if I can leave you with one thing today, it's this. You don't need to punish yourself with extreme restriction to lose visceral fat. Your body is not working against you, it's just responding to the signals you send it. Give it the right signals with foods that calm inflammation, support healthy insulin response, and activate fat burning, and pair that with movement you can actually sustain, and your body will do exactly what it's designed to do. If you found this helpful and want more practical, evidence-based health guidance, I'd love to have you join us for the next video.